We have quorum.
Okay, thanks. So I'll call the meeting to order. We'd like to recognize that collectively we're on the unceded territories of all the First Nations within our regional boundaries. And I'll open the floor for nominations for chair of the hospital district.
I'll nominate Jen Ford.
I'd second that nomination.
Do you accept, Jen?
You're muted. Ineffective management. You should decline the nomination.
It's like the first time this year that's happened. Yes, thank you.
Thank you. I'll call a second time for nominations. And I will call a third time for nominations. Thanks. So Chair Ford is acclaimed as chair for the 2021 year. And I'll turn it over to you, Chair, for the election of the vice chair.
Thank you.
Thanks.
I will call for nominations of the vice chair.
I nominate Karen Elliott.
Do you accept?
I'll accept.
Thank you. I'll call for a second time. Any other nominations for vice chair? And a third and final time, any other nominations? Seeing none, I declare you the vice chair. Thank you very much. That's exciting. Thank you. We have a lot of work this year. Okay. And could I have someone move approval of the agenda? Moved by Director Race, seconded by Director Mack. Any opposed? Motion carries. And could I have someone move the resolution regarding M192? Moved by Director Elliott, seconded by Director Richmond. Any opposed? Motion carries. And could I have someone move number 5, the consent agenda? Moved by Director Elliott, seconded by Director Richmond. And any opposed? Motion carries. Any business arising from the minutes? Seeing none. Let's move to 7.1, provisional budget. And I see Director LaFrance here to, are you going to talk about the provisional budget?
Yeah, I can discuss it. I was hoping that the delegation would happen before, but because part of the budget does talk about the VCH delegation, but that's in the report as well, which isn't in the provisional budget. I purposefully left it out at this point. But yeah, the provisional budget is required as per the Hospital District Act, just to allow the operations to continue before the final budget is approved in March. And so this provisional budget shows the current approved projects from the board. And it also adds in the full amount that the board set aside for the Whistler Healthcare Trauma rooms upgrade. So that portion, from what I've seen with conversations or emails sent to me from the Whistler Healthcare Foundation, that can be separated into 2 fiscal years. So they have allocated $300,000 for 2021 and $200,000 for 2022. So there is an option to change that with the final budget if the board so desires. The budget also just includes the regular CPI of a 2% increase. We've been using that for all of our budgets. That's why I say the regular, but it could be much lower for 2020's CPI increase. I don't think there's anything else really to note, but it shows a small deficit carry forward from the previous year. And that is mainly due to the loss of interest income. The MFA investments, actually all investments in 2020 took a big tank for all of their all of their interest income and all of the yield to maturity just dropped drastically. And I think it was around July, and it continued for the rest of the year. So the interest income was far below our budgeted amount in 2020. And I'll just open it up for any questions to the board.
Go ahead, Director Race.
So I just wanted to make sure I'm reading this correctly, because if we raised the requisition by 15%, to add that, I don't have in front of me, that $1 million and change, then the total reserves that we would have, or the total cash on hand, is that $2.25 million number. It's in the statements to start with, and then after the expenditures you've listed, we'd end up with 1.5 million plus. That kind of just a capsule snapshot of it.
The 1.5 million, are you looking at the second page to the provisional budget that shows all the capital costs and how those were funded?
Yeah.
I lost you. I can't really find those exact numbers that you were listing out.
I'm looking at the provisional budget 2021, and it is the second page of Schedule A. And it's the one with all the numbers. You're right.
Okay, yeah.
And the requisition 1.208 and so forth, leaving total revenues, which includes a transfer from appropriations account, and I assume that that's kind of a carryover. That's kind of our cash on hand, like
That is what's in the reserve. Yes.
Okay, and so then including the Whistler expenditure, a little farther down, we're left with more or less 1.5 million cash on hand, and that's where we start any kind of discussion with our presenter, for example.
Yeah. So the Whistler trauma rooms is in there as a capital expense, but if that wasn't there, the available reserve amount would be about 780,918. I placed that expense in there. It's obviously not coming from the reserve, it's coming from the requisition for 2021. So yeah, it leaves the reserve add-on at 280,918.
And we did have a resolution about that a couple of months ago now, I think. So does that commit those funds, or do we require a confirming resolution now? Is there another step to take before those funds are confirmed? That expenditure is confirmed?
No, it was confirmed at the September board meeting that the funding request by the Whistler Healthcare Foundation for the trauma rooms upgrade at the Whistler Healthcare Center be approved in the amount of 500,000 with the payment schedule to be determined. So that was the resolution from September.
Okay. And maybe then I'll go through to the chair. I mean, do we know when we might pay that?
They weren't too stressed about getting it right away. They were happy with 300 in 2021 and 200 the following year, if that made it easier. Ms. LaFrance?
Yeah, it could open up opportunities to have other projects in 2021 for capital purposes.
I'll maybe stop there, Chair, just for the moment.
Okay. Yeah, Mr. Murray from Capital Planning for Vancouver Coastal has not yet shared too many details about what they will be asking for this year. So, well, we'll see at 3 o'clock. Any other questions? Oh, we could bring him in early. Why don't we do that? Does everyone come? He's here now. Yeah. So
He's on the agenda at 2:30.
Oh, I had him at 3 o'clock, didn't I? Okay. Nevertheless, he's here. Okay, so let's let's complete this no, why don't we pause this and we'll bring him in, and that's much better. Let's do that. Bring him in. First day, you know? Good afternoon, Mr. Murray.
Good afternoon.
Thank you for being here today.
Thank you very much for accommodating me.
All right, so we are looking forward to hearing your presentation. I'll leave it with you.
Thank you very much. I'm just gonna share my screen. Are you able to see the screen? Thank you.
Sorry to interrupt. I believe that Philippa was going to share the screen on behalf
That would be great.
of, and so I think if you can just cue her, she can move it forward for you.
Okay,
Is that okay? Thank you.
that would work. Thank you. So I can close this. My apology. Let me, can we flip over to the next slide? Thank you. Just to align us with our strategic priorities for VCH, number one, exceptional care, innovation for impact, and lastly, a great place to work. And that is with reference to our workforce and ensuring that we always have sufficient and the best people working for us. On the next slide is just the content, and we can skip over that as we will be going through it. The header for the capital planning framework. On the next slide, the drivers behind our capital investment overall. And I think the critical ones to reference here is the aging clinical equipment that we have, the aging infrastructure, as is evident, I think, coming to you from multiple requests to co-fund over the years. The market conditions, especially within the Lower Mainland, continue to be a massive challenge for us in terms of delivering capital projects, and an absolute increased cost that is on a runaway path. And it doesn't seem, COVID doesn't seem to have much of an impact at this point in time. Very important on the strategic side, most of the time we are geared towards delivering on government priorities, VCH priorities, and Providence priorities. I think one of the key things here that is new to us over the recent year and a half or so is the urgent care and primary, which we call the UPCCs, of which we have at the moment 3 deployed and operational within the Greater Vancouver area, excluding, of course, Fraser Health. We are actively working on some additional UPCCs within Vancouver South and in Richmond as well. The next slide, the story that we're trying to tell here is that predominantly due to the aging infrastructure, our investment is largely into updating and maintaining our critical infrastructure, and less of an opportunity to actually address the strategic priorities, which continue to be a battle overall. The next slide, the need for capital. The first bullet there is with reference to the projects that we currently have underway, over $1 billion of projects in excess of 2 million that is underway both on the facilities, equipment, and IMITS side. We have about 2.8 billion of priority investment asks into the Ministry of Health. That includes some of the projects which we will address here for the Sea to Sky region, or coastal rather. Deferred maintenance, again, the emphasis is on that. When we are looking at the infrastructure, VFA assessments, etc., we still have a substantial deficit in terms of our infrastructure. On the IMITS side, due to the fact that we've got CST or the Cerner system as a priority for rolling it out across Vancouver Coastal Health, we had to invest a substantial amount into our core infrastructure to be able to handle the larger system. With that are things such as Wi-Fi, which is fundamental to have the system operating at its capacity due to the fact that we are using equipment right within the patient room at the patient bedside. So Wi-Fi is becoming a huge enabling strategy for us to actually support the system. On the equipment side, to be honest, we are completely in a break fix mode. By that, I mean that we are really replacing what we have in place at the moment. And when we are looking at newer technology, we have been fortunate with our hospital foundations that is actually coming forward and funding some of the newer technology, which we don't otherwise would be able to afford. That is also with reference, I think, to some of the larger CT scanners, fluoroscopy units, for example, which is now also coming with a substantial price tag, MRIs as well. We've been fortunate there to get the support from other funders that help us. The real estate is a large issue for us, especially within the Greater Vancouver area, due to the runaway market that we're dealing with and our dependency on a tremendous amount of leased sites, especially within the downtown east side. We are fortunate, I think, that in the rural areas, this would be Squamish, where we have some lease sites, Seashelt and Powell River, we do not see the same kind of incremental increases in the communities there as we are seeing in Vancouver. So that is helpful. As you can remember, I think from last year's presentation, we are embarking on a number of long-term care facilities, and I will address that later in the presentation, where we are actually looking at renewing and expanding some of our facilities. The master side planning, we have two initiatives on the go at the moment. The one is at VGH, and the other one is at Sea to Sky, where we are doing a high-level master site plan. And towards the end, I can just perhaps provide you with a little bit of an update as to where we are and what is the anticipated timeline in delivering that piece of work. On to the next slide. We can just quickly glance over this. This is just the investment categories that we are grouping our capital projects by. Clinical renovations, facility infrastructure, long-term care, etc. On the equipment side, we just bulk everything into one. By that is major and minor equipment that sits within those buckets. And on the IT side, we broke it out between clinical applications, business applications, and the IT infrastructure. On to the next, and you can skip one more. Thank you. This is an extract from our May 13, 2020 funding letter. The first column for 2021, sort of in the middle of it, you'll see a number of 62 million. That is the amount of routine capital investment that was allocated to us. That includes the carbon neutral program. For next year, we're expecting 63 million, and as you can see, it basically stays at the $63 million allocation. There is quite a bit of work that is happening behind the scenes that we are advocating for more from the ministry to address our infrastructure shortfall that we have. And actually one of the staff that's reporting to me has been seconded to the Ministry of Health and will be focused on this initiative to actually increase or provide the support to increase our allocation from the ministry. The next slide. This is purely focused on just the coastal COC. So excluded from this is Vancouver, Richmond, and Providence Healthcare. As you can see, for 2021, our cash flow for this fiscal is around 19.5 million. And then we're going up quite a bit, 84, 110, and then dropping down again. The reason for the spike there is the acute care facility at Lions Gate Hospital, which is currently in the RFP process. Should I just stop and ask if there's any questions at this point?
Does anyone have any questions? No, I think you can carry on. Thank you.
Thank you very much. On the next slide is basically the listing of the projects. So we're grouping that again against clinical renovations and new builds and long-term care. So the Lionsgate acute care facility, at the moment, the price tag here is 254 million. That is the current approved amount, with 100 million coming from the Lionsgate Hospital Foundation. Through the process, the RFP process, it has become evident that that price is not sufficient. We are in the process of reviewing the final financials on that project that's been submitted, and we'll be going back to the Ministry of Health for additional funds to top us up. The other funding source that's included in this, just as a point of reference, is the sale of the Dogwood Pearson lands in Vancouver, and a substantial amount of $70 million has been allocated to this project. So when we initially started, there was no ministry money in this project at all, because we started at $166 million, which soon proved to be insufficient for the scope of work that we were undertaking. On the clinical renovations and long-term care, there's a bit of a highlighting. That is just to indicate the projects that is in the rural areas. On to the next slide. This is the core of the business, I think, in terms of the infrastructure upgrades that we are doing across. The very top section at the very bottom is with reference to Lionsgate, and then the other sites are in the middle here. One of those projects we will discuss a little bit later as part of the cost share request. On to the next slide, please, ma'am. So for clinical equipment, we have generally, over the last couple of years, increased our allocation. We were around 8 to 10 million. And for the first time in 2021, we moved that to 14 million. That was with some input from our board chair and the executive to really make an effort to address some of the deficit that we have in some of our aging infrastructure when it comes to the equipment. We are again very fortunate with large contributions coming from, in particular, Lionsgate Hospital Foundation, which is a substantial contributor to brand new equipment and technology. On to the next slide. This is just the approved major clinical equipment projects for 2021. The very first line, the 3.6 million there, we are typically getting approximately 1.2 million annually from the Lionsgate Hospital Foundation, in particular towards equipment. This is mainly the stuff that is under 100,000 that they fund as a pool. I also have to say that from Pal River and Seashalt, including the Squamish Hospital Foundation, we are getting contributions from them as well towards equipment. On to the next slide, please. So the IMITS bucket, currently within our cash flow, we have approximately 90 million that we are planning to spend within this fiscal. Of that, about 60 million relates to the Clinical System Transformation Project, or CERNR, as it is called. Most of what we do on the IT infrastructure side is actually to support the rollout of that system. Those include things like core and X switch replacements, power and cooling remediation, specifically in some of the closets that we have, network and data remediation, fiber optic cabling, and then the UPSs, which is our uninterrupted power supply units. A large cost is actually coming from additional data drops that's required to support the new system. And having said that, it also requires, in most of our older facilities, we need to add additional power outlets to support the equipment, which is really deployed within the unit itself. A lot of it is on wheels, but you still need to plug in at one point in time. And then I'm going to go straight to the cost share request. So we have two projects that we want to present to you for a cost share. The first one is the replacement of the fluoroscopy unit within Squamish General Hospital. There's a bit of a description to the right there. The unit is currently not running, so that is a challenge for us. We are doing quite a bit of assessment work at the moment to replace that unit. We have not initiated the project as such. It's just the planning work, as we are hopeful that we can get support from you to replace this unit. It is also serving as an alternative to the existing X-ray within the hospital. And then secondly, we need to replace an air cooler chiller in Squamish, and that is fortunately coming at a little bit of a lower price tag. That is a 19-year-old unit that we need to replace. So the total ask that we have from you is approximately, or exactly, $760,000 to support those two projects. And I will just pause there for a moment if there are any questions pertaining to those two requests.
Anyone have any questions at this point? Go ahead, Director Race.
Thank you. So the radiology fluoroscopy replacement, is that is that new technology that would be purchased?
Yes, sir. Absolutely. It would be brand new technology. Yes.
And
As you can see from the description here, I think the older technology is creating a bit of a challenge in terms of the actual bed in moving people around within that room. All of that will be addressed within the replacement.
And going back to the previous slide, I was trying to follow the one that had the more fine print on it. Is it possible to, no, not that one,
On the equipment?
that one.
Yes, sir.
So I was trying, is that listed here?
Yes, sir, it is.
So I'm looking, okay, so that's number 7, there we are. And in 2021, looks like $200,000. And then 21, 22. So is this over 3 years?
It's over 3 years, yes, because we right now, once we have the funding secured from you, we do have government funding secured already. We are in December now, so very little spend will actually occur. The vast majority of the project will be delivered within 21, 22. The reason for the 400,000 sitting out in 2023 is that basically there may be some deficiencies, there may be some holdbacks, and that's what that is for. But the anticipation is that the project will finish early 2022.
So in terms of funding, that 720,000, I can appreciate you'd need the commitment now for the whole thing. But what would the timing be that you would expect the funds? How much this year, next year, and so forth?
We would probably expect no more than about 50% of the 720 ask within your fiscal 2022 and the rest in 2023. Because you are January to December, your annual, your fiscal, right?
I think so, yeah.
Yep. So if it
2021.
It can be spread over 2 years.
Okay. Between 21 and 22.
Yes, sir.
Okay.
We have the exact same project that we are tackling in Powell River as well, identical to this one. A little bit of a different unit that is there compared to what you have in Squamish.
Okay. Thank you, Chair.
Thank you. Any other questions? Okay, let's keep going.
Thank you. And then the next is to address the upcoming capital priorities. Next, right there. Perfect. Thank you. So this is the projects which we submitted in the 1920 capital plan, 10-year capital plan to the ministry. And these are the ones that was actually approved for us to proceed with. Work is happening and work has been initiated since July of this year for the planning of all of this. We are not nearly at a point of a business plan, and each one of these projects will be individually approved by Treasury Board once we submit the business plan. So right now, we do not have a defined dollar allocation to these projects, although our submission did include a specific ask. But I believe that overall for the province, the allocation is in excess of $1 billion towards expansion and replacement of long-term care projects. So we are anticipating that just shy of $500 million will be coming our way for these projects. Is there any comment on those at the moment?
Director Race, then Director Elliott.
Thank you. Just with respect to the Hilltop House expansion, can you give us some idea of what that entails? How many additional beds or rooms?
Sir, at this point, I don't know. I believe that it will soon be solidified in terms of the quantity of beds that we will be adding, but that will probably be dictated through the population assessment, the site itself, and the need.
Okay, thank you, Chair.
Thank you.
Director Elliott?
I'm going to ask about the same thing. So our community has been hearing about this potential expansion to Hilltop House for a little while now. And it's hard to know what this timing or how we maintain the expectations of the community, because it says a 10-year plan priority. So where does this fit in that 10-year plan?
Right. So within the 10-year plan, I can assure you that Hilltop is absolutely one of the highest priorities. Hilltop, Evergreen, at Lionsgate, those are the two key ones within this bundle of projects. We have a team that's dedicated to this work. That work is ongoing. And that is as much as I can say, but we are not looking at 5 or 10 years from now. This is a question of getting all the work ready, getting the business plan in, and moving it forward to government.
Would these long-term care facilities like Hilltop House be eligible for some of the specific funds the government set aside to retrofit or better
Yes.
position long-term care because of the pandemic? They set aside a certain amount of money to do that.
Yeah, and I honestly, whether that is in addition to what we've already been communicated, that's really hard for me to speak to that, because the communication that we have received prior to COVID is that definitely there is $1 billion that's been set aside provincially for the replacement and expansion. So whether the COVID allocation is in addition to that, I am making that assumption, yes.
Okay, thank you.
On to the next slide. This is just the priorities that sits within the coastal area. We are still looking at funding for the surgical suite in Sechelt Hospital. The challenge there is that there's only one OR functioning at the moment due to many reasons. That is a critical project. We also have the support from the Sechelt Hospital Foundation and trying to really accelerate that as quite an urgent project. On the second page, there is the Shorncliffe and Totem Lodge, both facilities within the Sechelt catchment area. The reason for the repurposing is because of the new facility that is being planned for, which is a private provider. Once they have moved out, which is approximately a 3 to 4 year time frame from now, we will then revisit and repurpose Shorncliffe. Totem Lodge sits right on the hospital site at Sechelt, adjacent to the hospital. So it is possible that that may be repurposed for something like mental health, because on that site they actually have 2 trailers that's been there for years. And it's time to get away from the trailers into something a little bit more permanent. So that is the purpose of those 2 projects. And then the next slide is really just addressing the prioritization process that we are going through to determine which infrastructure projects and which clinical upgrades or renovations we need to undertake. This goes through a Ministry of Health scoring tool, which I've attached here. I think the next slide actually, sorry, speaks to the key considerations that we take into account, such as the age and condition of the infrastructure, the likelihood and severity of risk to the patient, the business case and the possible operating gains associated with that, quality improvement and access to the patients, and to reduce essentially the length of stay within the acute setting. In many cases, we have to consider which other projects are underway at a specific site as well, so we don't overburden the site from a clinical perspective with too many interventions, whether it be clinical or an infrastructure that's being replaced, a cooler, etc., that's being replaced. Those things do need to be managed, and we try to minimize the impact to clinical services to the best we can. On to the next slide is just the scoring tool itself. For those of you who are interested in that, just the various elements that we review. When we actually come forward with a list of projects against the $63 million allocated, we typically find that the ask is well in excess of 100 million, typically. So the score is critically and important. We also look at a little bit of a fairness between the different communities, so that we don't give essentially all of the money to either Vancouver or Richmond or Lionsgate for that matter. So we try to be very equitable across all the sites, including the rural sites. And I think that page kind of wraps up my presentation. And then I just want to speak very quickly to the high-level master site plan. Now, my understanding is, as of today, the RFP has gone out for the consultants, and it will close on January the 17th. The budget at this point is $500,000, $500,000. I just want to not make an excuse, but just state that due to the election that recently occurred, a lot of our work has been put on hold by the ministry in terms of issuing RFPs, etc. So this one got caught up in that process, and this is why we are only moving with it now versus in the fall. The RFP is very specific in terms of a prime consultant, a clinical service planner, mechanical, electrical, structural, and code consultants. The interview for these shortlisted proponents will happen in the first week of February 2021. And stakeholder engagement meetings will commence in March 2021. The anticipated completion overall is April 2022, just to give you a timeline on that. When we are looking at the clinical service planning, that is currently scheduled for the March to June timeframe. The facilities planning is roughly from March to July. And then for the planning strategies, we are looking at the July to November 2021 timeline. That includes the facility infrastructure gap analysis, the development of environmental, sustainable, and resilience strategy, real estate and leasing strategy, and the development of the master site plan strategy overall. And then the integrated high-level master site plan is scheduled to be complete around the December 2021 to the March 2022 timeframe, with final presentation to the steering committee by April 2022. I am very happy I can actually send you a one-pager if that would be helpful. For your record.
Yes, that would be helpful. Thank you.
Perfect. I will send this right after the meeting.
Thank you. Does anyone have any questions? Go ahead, Director Elliott.
I haven't seen the RFP, but when you say there's stakeholder engagement starting in March, does that include broad public engagement, or are we just talking about clinical people and regional hospital districts, or are we actually going to put this out to the public and say, what do you see?
Yeah, I believe there's going to be public engagement. The actual time frame of that, I am not that close to it right now yet to be able to speak to that. But my guess would be that that would be within the March to July time frame.
Thank you.
Thank you.
Did I see another hand, Director Richmond, or nope? Okay. Any other questions or comments? Go ahead, Director Elliott.
I don't suppose our public health systems need any refrigerators for vaccines, do they? Or are we well positioned in the sea to sky corridor?
I don't know. I have not seen a request coming across my desk for any fridges there. No. To date, I have only seen one coming forward for our immunization clinic, the public one, where people actually go and pay for that. That's the only one. I think the rest we have in place.
Okay.
Okay. Thank you very much, Mr. Murray.
Thank you. Thank you very much. And sorry.
That's great. So we will now carry on with our deliberations over our provisional budget, and I guess we will get back to you.
Thank you. I really appreciate it. It would be really appreciated if you could get back to me at your earliest convenience. That would be awesome, so that we can get going on these projects.
Okay.
Thank you.
Thank you. Thank you for being here.
Thank you very much, and happy holidays. Merry Christmas to all of you. Thank you.
Merry Christmas.
Thanks.
Okay, so just for clarity, so we have this provisional budget in the package, which currently includes the asks that they came to us in September. Am I right? So the sprinklers and the things that we approved then, plus the trauma room, but does not include this current ask of 1.2. I'm losing all my numbers.
760 total.
760 total, right. So we would have to add that to the 1.512 that's listed on page so we're adding that basically if we approve that.
Yeah, there would have to be some adjustments because currently there isn't enough funding to approve that whole amount. But if we wanted to split it into the 2 fiscal years, we can do half and half for the fluoroscopy unit, and then the full amount for the chiller, the
which
That
is,
one should be fine.
that one's 40.
And if, as per the resolution for the requisition increase in 2021, which would just be a 10% increase, there would be enough funding to do those projects. It split apart, as well as splitting apart the trauma rooms for the Whistler Medical Center as well, to do the 300 this in 2021 and then the 200 in 2022. And then at the end of 2022, I just did a rough estimate. We would still have 664,000 available for future projects.
Okay. Any Director Race?
So the number at the end of 22, that would be assuming that we hold the requisition at the increased rate. So if we increase it 15% this year, level following year. And
10% following.
beg your pardon, I'm sorry.
The resolution from the September board was 15% in 2021, which is what is shown in the provisional budget. And the 2022 is to be 10%.
10%, okay.
And that is assuming that we don't get any new asks regarding the master plan, the Hilltop expansion, which hopefully is included within that master planning discussion. Okay, any other questions? Yep, go ahead, Director Race.
Follow up. I guess I'm thinking back, and I'm trying not to have another rant. So I'm just thinking back to the previous rant, and do we have any other local initiatives? I mean, we know about the Whistler emergency upgrade, but have we heard from other foundations? Are there other things going on that, I mean, we've seen a letter from Pemberton, for example, and I know that's a bit of a process to start getting coastal health on side with that, but are there other things that these other areas have put forward that that might also be something that's kind of in a local sense, if you like, or something that is not sort of business as usual for coastal health?
Yeah, there's the primary care task force with that's being led by the Sea to Sky divisions of family practice, have been working on a process to identify a change to the way primary care is delivered in Whistler and Squamish, and predominantly in Whistler, because we are down to 5 full-time practicing GPs, and we need 14 to service our community. And so there could be, it certainly wouldn't be an ask, but support is on the horizon. So certainly no commitments have. They haven't even got the final plan, but that's in our near future to understand that differently. And yeah, I think the refrigeration question is a really good one. I mean, that's going to be a short term. Hopefully they get all the vaccines out and then that's it. But I've heard from First Nations Health Authority that the challenge with the rural communities such as ours is that Pfizer doesn't travel well and doesn't go long distances. So the Moderna will be a better option for us because it doesn't require the deep freeze that Pfizer does. I was chatting with a pharmacist here in town who says that there isn't any of those minus 70 refrigeration units anywhere in the corridor. So, so that's something to think about. Director Crompton.
We haven't heard the request. I wonder if we research it ourselves, and who would be the ones that would, I mean, maybe even just a call to John Harding that said if there was resources available to support vaccination from the health authority, could you use it? And And then secondly, I feel like one of the best moves we can make is to not invest, because I would love to see us reach out to the Squamish Hospice Society and say, can we do another room? Is there anything else that is in your brains that could come out? And then we would have capital projects reserves to be able to invest in something effective. I love the trauma room move, and I love that. Was it under one roof? Where did we invest previously? We did Squamish Hospice. Did we put anything into under one roof or no? We did. Okay. And it's because we had savings. And so in some ways, I feel like one of the most effective moves we can make is to not just push money out the door because it is requested. So.
Director Elliott, go ahead.
I think the thing is, one of the things that I hear in my community all the time is I don't want to keep going to Lionsgate Hospital to get treatment that I think I should be able to get here. And fluoroscopy is a treatment that most people don't want to have to go down to the city for that procedure. A lot of them, especially when it comes to your intestines, would rather do that close to home. And so, it's one of the reasons I supported the mental health room build at SGH last time, so that we could keep people in mental health crisis closer to home. And I feel like this is another ask that is keeping people in the corridor. That's going to be a piece of equipment that's really well used. And the seniors in my community is the fastest growing demographic. They're not the biggest cohort, but they're the fastest growing. And I tell you what, like, bowel cancer is something that's affecting young people in our community now. And so having, state-of-the-art equipment in the corridor is something that we shouldn't, toss away or delay. So I think that the requisitions that the board has approved and spreading the ask over 2 years allows us to still have those rainy day funds and build those up while the master planning process is unfolding. So I think there's a balance to be had here for sure. But I don't have anyone in Squamish, saying we need this, we need this, we need this. Like, I haven't heard those requests.
Go ahead, Director Crompton.
I'm sold. I'm convinced on the fluoroscopy.
Okay. Director Race?
Yeah, that's why I asked the question about whether it was kind of like last year we were replacing plumbing with plumbing more or less, and that one really aggravated me. But this is apparently, and maybe it's inevitable because it's just passage of time, but it's a step up in treatment level. And so there is a corridor benefit to that. And the ability to stretch it over 2 years certainly helps. I do tend to agree with Director Crompton though, and I think, this stuff is not cheap. And if we're going to be able to have an impact in whatever area, we're going to need, easily we should be aiming for something like $1 million just kind of sitting there unallocated for something that might come along. And one of the things I can think of, stretching these things over 2 years, both the Whistler ask and this one certainly helps. But I think the other thing we might consider doing is going from 10 to 15% the following year. So 15% this year and 15% next year, and see where that might lead us. And I think we get closer to a significant amount of money then. And we went through the exercise last year. These increases we're talking about, when you look at it on a per household basis, are relatively small numbers. It's like a cup of coffee almost. It's just ridiculous. And so spread amongst a lot of people, we have the ability to raise these monies without really hurting the taxpayer. And they do when they are allocated, they do provide a lot of benefit, of course, for that. So I'd be inclined to think that way. Go with these, stretch them over 2 years, and then work on getting the reserves together for the next one.
Anybody that I missed? Yep, Director Richmond.
So I agree with most of what has been said, including investing in the fluoroscopy. I think we've made a very big jump in our requisition with the 15 and the 10. I wouldn't be supportive of going for another 15 right now. We heard earlier from our other municipalities that they're trying to keep taxes down to 1% increase, nothing on utilities, for obvious reasons. Now, I supported the rationale for building up and agree with Director Race that we need those kind of funds to build up, but I don't feel positioned right now to change the previous resolution and go for 15% next year. I would stay the course with what we laid out and continue to look at priorities. I do want to ask the group, though, we've talked a lot about the radiology, but we haven't talked about, so I would support the radiology, the fluoroscopy for over 2 years as well. I haven't heard anything else from the rest of the board about the air-cooled chiller. Is that something that we feel we should be investing in? That's more like your comment, plumbing for plumbing, in my mind. So I'm happy with the 720 over 2 years, but what about the air-cooled chiller? How do people feel about that?
I think that was one of those types of units that it was like the oxygen farm or the oxygen tank farm. You know, it's it makes it more convenient to do what they need to do. And yeah, it's definitely not sexy. You wouldn't want to go fundraising for it, but it's one of those things that they need. And hopefully it's an upgrade to efficiency rather than you know, creating more waste and whatnot. So I don't have a problem with that one, but go ahead, Director Race.
Well, and it might be, frankly, I haven't got a clue what it is, but it was a small number, and so I just honestly wasn't focused on it. It almost didn't matter. And just to be clear, what I was talking about was 15% this year, which we were doing, and not an additional 15, but just going from 10 to 15 next year. And I take your point. You know, these things do add up, but that decision is a year away, I think. You know, we can sort of think about that, but we don't have to make that second 15 decision today. And we'll just kind of see what's out there and where we are, and or you will, I guess, when that time comes around. So, but anyway, I'm kind of ambivalent on that one. I mean, it's almost an aggravation to toss it on, and probably just an aggravation for them if we omitted it. So I can go either way in that one.
Okay. Go ahead, Director Elliott.
Yeah, I'm fine to include it, but if people don't want to, I'm also fine to leave it. But it'd be interesting to think about as we go into the master planning process is actually having a meeting, possibly not the whole regional hospital district board, but Director Ford and I meeting with the heads of the hospital foundations and looking at a more collaborative approach to what's coming out of the master plan and who can fund what and who's interested in funding what, because I think out of this master planning process, we'll see, I think a lot of people will be pushing for an expansion of services and increasing our access to preventative medicine and testing equipment. So I think that conversation should probably happen somewhere between that March, July timeframe when they are out doing engagements, so that we're bringing a sort of more unified approach to the discussion. But on this funding, I think we should just put a motion on the floor for each item and vote it. All
right, are you making the motion as laid out in the package to approve or to give first, second, and third reading to the provisional budget as laid out? Oh, no, we want to add those items to the provisional budget as
So
laid
I'll
out.
move that we support the fluoroscopy unit over 2 fiscal years.
Second.
Okay. Any further discussion? Call the question. Anyone opposed? Motion carries. Then do you want to make a motion on the second item?
Yeah, I'll make a motion that we fund the chiller.
We'll fund the chiller in 2021. Do I have a seconder? Seconded by Director Race. Any further discussion? Call the question. Anyone opposed?
I want to speak.
Oh,
I encourage you all to vote against this. You know, this small amount of money, if we end up getting somewhere and they need a real chiller, like a vaccine chiller, then we'll have some resources to do it. And this feels like it's not a local priority. So I will vote against it. I know it's a small number.
compelling argument. Does anyone else have anything to say on this? All right. I'll call the question. Is anyone opposed? Oh, okay. The motion fails. Let the record show that Director Mack, Director Elliott, Director Richmond, and Director Crompton voted against this. We will not approve that. Okay. So now we have,
Can I move the provisional budget with the inclusion of the fluoroscopy unit?
thank you. Do I have a seconder? Seconded by Director Crompton. Oh, Director Race, go ahead.
Well, and just to be clear, the other change is to split the Whistler ask over 2 years, 300 and 200. So that would reflect in this provisional budget.
Friendly amendment. Thank you.
So we'll move it with the trauma room split over 2 years and the fluoroscopy unit split over 2 fiscal years.
Okay. Any further discussion? I'll call the question. Is anyone opposed? Motion carries. And then a final motion to adopt the provisional budget. Moved by Director Crompton. Seconded by Director Elliott. Call the question. Is anyone opposed? Motion carries. All right. That was fun. 8.1 CAO verbal update.
Thank you, Chair. Nothing at this time.
Okay, thank you. 8.2, to approve the board meeting schedule as laid out in the package. Can I have someone make that motion? Moved by Director Elliott, seconded by Director Richmond. Call the question. Anyone opposed? Motion carries. 9.1, Chair verbal report. I have had a lot of meetings in the last month regarding, we had, well, at UBCM, we had a meeting with the Ministry of Health, a staff member there. We talked about the outdatedness of the Regional Hospital District Act, or the Regional Hospital Act. And he basically said that's something that has been on the table of every minister of health for the last 40 years to update the act. It hasn't been updated in forever. There are things in there that hold us back, such as our ability to make local governance and local priorities known. So I would suggest that if anyone has some time to look at the act and perhaps bring forward to a future meeting any suggestions of updates that you can see. I'm sure there are some. I don't want to take this on. It's just a side of the desk kind of activity if you're interested in that kind of thing. The second meeting that I had was with Vancouver Coastal Health Community Public Health Liaison, and it was essentially a roundtable of staff from the District of Squamish. There were the Southern Statlium Health Society. We had myself was there. Sarah Morgan attended, and no, Nope, that was the one where CAO Helmer attended with me. And everyone just gave an update of where their COVID response is. That was interesting. And then we had the Vancouver Coastal Communities Regional Hospital District Chairs Forum. That was in November. And that was about it. So that's my update. Could I have someone move receipt for information? Moved by Director Crompton. Does anyone have any questions? I am happy to share my input later on. I'll call the question. Anyone opposed? Motion carries. Thank you. Any late business? Actually, I want to reopen my verbal, and I want to say, in the context of the Regional Hospital District, and in recognition of your many years of service, Director Race, we are so lucky to have had you here, and we want to say thank you from the very bottom of our hearts for your dedication to the hospital in Squamish and the entire corridor for however many years you've sat on this board. We are very grateful. Anyone else like to add to that?
I would. Are you here tomorrow, Doug? Okay, good. So we get lots of chances to say good things about you tomorrow as well. But as it relates to the hospital district, I have always found your it's been fun to work with you on the hospital district, because I feel like we've had a clear vision of where we want this to go as far as this desire to see local priorities guide us. And I find you a very centering force on boards that I sit with you on. You help remind us of what we believe to be true. You are kind and calm and direct in that work, and it's such a pleasure to sit at a table with you. I find it inspiring. I want to be a better board member as a result of the way you engage. You engage and bring peace. And I just find that to be so inspiring. So I'm grateful. It's been fun to sit alongside you at hospital district meetings for the last however long it's been. I've enjoyed it very much.
Thank you. Director Race.
Thank you. It's been 6 years, because the first couple of terms that I was associated with the board, I was an alternate, and so I didn't actually attend any hospital district meetings during that time. So it's been the time that you were chair last term and this term, and I'm actually amazed that I had that effect on you, but now I'll consider you my legacy. and carry on. And it has been great. And it's one of these things. It's almost it's like a motherhood issue, really, because I've been involved in the Hospital Foundation in Squamish, led a fundraising years ago, and it's one of these things that we need. I've told a lot of people this story that during this fundraising, we had a whole bunch of people in the boardroom at the Squamish Hospital. And I was giving my Newt Rockney to try and get them all primed up, and said, I walked in here on my own 2 feet today, but one of these days I might come in here feet first, and I want this place to be ready for me, kind of thing. And sure enough, I blew out my knee and went in there feet first one day. And so looking around the operating theater at all of the neat stuff that we bought, and I was getting operated on in Squamish the same day I had the injury, and it was what's supposed to happen. So it's just, and this is another source of the support. We're always going to have this aggravation of the provincial download. I just, listening to that guy who is like the Teflon man, it's just hard to disagree with him, although it is in effect a local download, and so it's just one of those ongoing struggles, I guess, going forward. But I've enjoyed working with you guys too. It has been good. It's been constructive, and we are making a difference in our community with that. So thank you very much. Thank you, Chair.
Okay. Anyone else? Director Richmond?
My goodwill towards Doug is quite limited, so I'm going to save what I have for tomorrow. That's it. And although if we were in person, Doug, I would want to rub your forehead in thanks right now, just so you know. I'll save it for tomorrow.
Okay. With that, thank you very much. And there was no late business. Are there any notice of motions from the floor? Seeing none. Could I have someone move adjournment of this meeting? Moved by Director Elliott, seconded by Director Crompton. Call the question. Anyone opposed? Motion carries. Thank you. We'll see you all tomorrow morning, bright and squirrely at 9 a.m.
See you guys. Bye.